Welcome, folks, to One Wild World. Today, we're exploring the incredible work of the Street Dog Coalition. We're joined by two incredible guests, Katrina Weschler, the executive director leading the charge, and Dr. Hilary Weschler, the compassionate medical director. We're diving headfirst into their work to unravel the stories of the four-legged companions of those experiencing homelessness and the heroes providing them with veterinary care. Katrina and Dr. Weschler are the unsung champions, bringing medical care and a touch of humanity to those who need it most. Join us for an episode shedding light on the profound work that's not just about dogs. It's about compassion, community, and making a difference in the lives of our furry friends on the streets, where every wag of the tail tells a story and every bark echoes resilience. Welcome to One Wild World. Today we are joined by Executive Director Katrina Weschler and Medical Director Dr. Hilary Weschler with the Street Dog Coalition. Welcome, both of you. Thanks for being on the show today.
Thank you. We're thrilled to be here.
Thank you for having us.
Yeah. Okay. Katrina, let's start with you. Can you tell us a little bit more about the history and the work done by the Street Dog Coalition?
Absolutely. Yeah, it feels like just yesterday, but the Street Dog Coalition was founded in 2015. So we've been around for just over 8 years. And our mission is to provide free medical care and related services to pets of people experiencing or at risk of homelessness. And this idea, this concept really took root in Fort Collins, Colorado, and has since really blossomed. And we are now in over 60 cities across the U.S., and we are truly run by volunteers. Our staff is very small and scrappy, but the majority of the folks really on the ground doing the work, all volunteers with hearts of gold. And that's how we're able to function, is by people giving their time and their talent and their treasure. And then, of course, we have some legacy sponsors that also help us out and supply much needed medication, vaccines, and quite frankly, funds to keep us operational. So we've done a lot in 8 years, and we continue to grow. And the key to that is growing sustainably and making sure that we're taking care of what we like to say, both ends of the leash. So the pet and the pet owner, but also those providing the care. We also want to make sure that we're taking good care of our volunteers and that small, scrappy staff that we've been able to bring on.
Yeah, Hearts of Gold is a theme that runs throughout every facet of Street Dog Coalition, I would imagine. Hilary, what does it mean to be the medical director for Street Dog Coalition?
So this is a new role. I actually joined the organization from a staffing standpoint, and I started off as a volunteer and continue to volunteer locally as a veterinary team lead. And we can go more into that, but that's part of how we work. Is we have veterinarians in various cities across the country who start their own teams with the support of the Street Dog Coalition and start helping those communities in need in their locations. And so for me, it became something I was so incredibly passionate about that I think that was able to shine through in my interactions with Katrina and our founder, Dr. Geller. And when they decided to put the search out internally for a medical director, I was jumping up and down in my seat, raising my hand, waving my arms in the air. And I've taken on that role. And so now we're really figuring that out as we go. But most of what I'm doing is supporting our veterinarians and our medical staff across the country. And again, those are all volunteers. And we want to make this as easy as possible for them to remove barriers in their ability to provide that care to the pets of people experiencing homelessness in their communities. We also have to come up with medical protocols for various parts of the country. There are different diseases we might see, different medications used to treat those conditions, determining what medications we should be supplying and providing, determining how to treat certain conditions, also looking at the products that we carry and what we feel is most appropriate for our teams.
Incredible. And I'm interested to hear from both of you on this because I think how people initially find their passion for animals and then how that leads them to their current position is completely unique for everyone. Katrina, can you start? How'd you find your passion for animals? And then what journey did that take you on to the coalition?
Oh, I love that question so much. I grew up in a big family and we always had usually more than one dog in the house. So I grew up with family pets. But truly, my connection to my own dog, Ferdinand, when I was in my early 20s, I found him, he found me. The bond that I have with him to this day is one of the most unique, incredible, powerful bonds I've truly ever experienced, probably until I met my current fiance, but that's different, right? This love for my dog, I just felt it on this level that I honestly didn't feel it with my family pets as much. I think I shared that responsibility with my siblings, and my parents probably looked after those dogs better than we did. This one dog was my sole responsibility, and he depended on me. And quite honestly, I depended on him. It changed my perspective. And I was at the time working for a nonprofit that benefited the arts, and I loved the arts. I loved speaking about it, but I was not an artist. And I didn't have that type of experience. I was volunteering with Street Dog Coalition when I was attending graduate school with the intention of moving up the ranks in this art administration world. And I did a full pivot and stayed with John Geller, our founder, to build the infrastructure of the Street Dog Coalition. And I noticed that when I started telling the story of Street Dog Coalition, I would often be thinking about my dog Ferdinand. And I was speaking from a place of experience in the sense of the human-animal bond. I was not speaking from lived, unhoused experiences, but I could easily put myself in those shoes. If I were to be without a home, I would never separate from Ferdinand. I would go without housing to stay with my dog. So the difference there is that I could speak to that from a place of just pure love and intention. So I used my nonprofit management experience to build the Street Dog Coalition, but I really used my love for my dog Ferdinand to fuel me as we got going. And he is my reminder for why I got started doing this and why I want to continue doing it. Because that bond is so special. And we meet people in our street clinics who truly, that dog, sometimes cat, is a lifeline for that individual who is unhoused. And man, it's just like a total game changer when you're able to supply care to the pet, because you're sometimes supplying care to the person just by recognizing the importance of that relationship. So that would be my roots story.
I think it's so important to have that passion. And when you get to work in an area where that passion kind of aligns, it is a very fueling thing. I know for many people, having pets, they are family members. And so I know for me, whenever we have these episodes, I have to have a conversation with my dog and cat before I step into the room of, I don't enjoy not having you in the office, but you just got to be out here. Please be on your best behavior. No howling. Hilary, how about you? How did you first find your passion for animals, and then what led you to being the medical director?
Honestly, I was the classic story of the child who always wanted to be a veterinarian when she grew up. And I think a lot of that came from my deep connection to our family pets. And I think there is a lot you can teach veterinarians, but I think many of us already go into this having a little bit of a deeper understanding of just how much that human-animal bond affects our lives on a day-to-day basis. And for me, that was absolutely the case. My animals were my source of unconditional love and comfort all throughout my life. And I was driven by that. And when I started really thinking seriously about what I wanted to do with that in this world, I realized that becoming a veterinarian was really going to be the best way for me to fuel myself, bring that passion into everything I do, and really where I felt I could make the greatest change and in a positive way affect other people and help other animals. And so I went on to go through veterinary school, loved every step of that, but it's a job, like many jobs, comes with its own challenges, hardships. It is not playing with puppies and kittens every day. And so for me, Street Dog Coalition became my newfound passion and a way to really fill my cup, so to speak, and in a very different manner than my day job as a veterinarian, because it's such a true organic interaction with people that would otherwise not have access to that care, but not just helping those animals and providing them with medical services they would not ordinarily receive, but having the opportunity to connect with people over that common bond, that human animal bond, and really understanding that unconditional love and purpose. We all need purpose in our life. And for many of us, animals give us purpose. They make you get up and take your dog for a walk every day, or your cat jumps on your laptop while you're working and forces you to pay attention. So for the unhoused population of people, for many of them, their animal is their lifeline and gives them that purpose. And so I see in them what I saw in myself with that love for sharing that connection with animals that's almost inexplicable when you try to describe it. But for me, that's what's driven me throughout my career. And now I'm just so thrilled to be part of an organization that's going to continue spreading that love and allowing me to continue to channel my passion into helping more and more people and their pets.
I love to hear that. I think it is fun to talk about that journey and just like what leads people to where they're at. Because for some people, it is like your experience, Hilary, where you just know from a young age what you want to do. And then it's just great. I want to just accomplish that. And for other people, you take those like temp jobs or seasonal positions and you just end up doing something that you like. And then there's also a third category where you have a job that you're doing, but maybe in your free time, you're either volunteering or you just have a hobby with wildlife or animals. And that's how you can, like you said, fill your cup as well. One thing that excites me a lot about the Street Dog Coalition is that it was started in Fort Collins, Colorado. That's where I went to school, so it's an important town to me. And that was started in 2015. Since then, the organization's really expanded. And Katrina, I think you mentioned that now there's teams in over 60 cities. Is that correct?
That is correct. Yes.
What does it mean to be able to establish such a presence?
It's really remarkable. And I credit our volunteers and word of mouth. I think that we have grown very organically because people hear about Street Dog Coalition and then want to help. And when they reach out, we reach back and we try to make it very easy for a new team to get started. We try to remove barriers to care by removing barriers to volunteer. Because sometimes volunteering can just feel like a lot. Maybe it's too much to take on. You don't know where to start. But if you reach out to Street Dog Coalition, we make it as easy as possible. I think that's how we have grown organically and are now in 60 cities and growing. We're very much on a personal relationship with all of our volunteers. We try to harness their ability to give back, but also we try to encourage them to take a step back if it does ever feel like it's too much, so then they can keep giving. I think that Street Dog Coalition is unique in that every team is different. Every clinic looks different, but our goal is the same. Our goal is to provide this care free of charge and to make sure that we're caring for both ends of the leash. And we have the ability to scale up. Our mission right now is provide that basic free medical care related services to the pet. But big picture, we're thinking One Health. So we want to be able to provide medical care to the human as well, and other services like haircuts or a good meal, hygiene kits, access to social workers. So that's our big picture. And it's really neat that we can layer that in as time goes on, as partnerships and more connections are made. I think it's also important to establish trust with the pet owners that we're helping and the other community partners that we're hopefully collaborating with. We want to scale up organically, and sometimes projects come to us, such as Operation Ukraine, where there was a need and we had to act quickly to meet the need. And really, it was the response of our amazing base and all the donors that pitched in to make that possible.
For people that are experiencing or at risk of homelessness, I think it's important that they don't feel alone or judged. And through that, I think we can understand that decision to have a pet. And there was also something I saw on the website that I think really resonated with me, which was, it was a quote, and it was that having a home doesn't necessarily guarantee someone has a heart, and vice versa. And so to expand on that, Hilary, are you able to explain the approaches to street medicine in what's called that One Health?
Yeah. So for us, what we have found is when we go out into communities, especially people that have been experiencing homelessness, oftentimes these people have been neglected their animals are not neglected, because what's amazing to me, and I learned this through my work with Street Dog Coalition, is those animals are incredibly well cared for, because people will go without a meal in order to ensure that their companion animal can get that food and care and love. But one thing we've seen is that sometimes there's a lack of trust in those of us coming to help. And we think that it should be welcome, open arms. Everyone should be ready to receive what we're here to provide. And you have to really find a way to connect and establish trust with the individual. And once we're in and we're able to provide that care with no judgment, unconditional love, which is one of our core values. Trust is also another one. Once we do that, we find people are more receptive to other ways that they may be able to receive services. So whether that's shower services, day shelters, social workers, healthcare, all of those aspects, if they see we are here from a place of love and we're here from a place of we're just truly here to ensure that you can continue taking excellent care of your pet and provide you with the resources you need to be able to do that, it's amazing how quickly they are willing to actually now talk to others. And that's really the One Health perspective, is we're very intertwined: animals, the environment, human beings. And certainly with the ability to all coexist, we need to be caring for one another. And so One Health for our organization means working with other groups that are also providing services to really care for lives on both ends of the leash. So that human, making sure they have what they need so they can continue to take care of their animal. And that means keeping them together. That's probably the biggest message I can put out there, is we can't create housing and shelter for people and expect them to jump at that opportunity if we're telling them that their animal can't come with them. I would stay on the streets if you did that to me. I would stay with my dog or my cat. And so we have to really look at that big picture of these animals are actually providing these people with a reason to keep going, even in sometimes the most dire circumstances. So whatever we can do to collaborate with other organizations, and unbridled collaboration is another one of our core values, that's going to allow us to take care of them really from a holistic perspective. So hopefully that's what we encourage our teams to do, and we try to open those doors for them as well.
Hilary just nailed 3 of our 4 core values. The 4th is super in line with what she was just saying about advocating, right? The 4th is compassionate activism. And we are compassionately pushing legislation for co-housing. There is an act, it's called the PUP Act. And we're going to be actively using our base to get more support. We're really hoping for bipartisan support. And this act would allow for co-housing. It encourages shelters to modify so they can allow pets to come with their people. So that's just another 4th value of ours. And we really do put our hearts behind it, because it's important to lift up those voices however we can to help the greater good.
Absolutely. Yeah. That's exciting that we were able to list all 4. I think I was also similarly counting, and I was like, okay, we got 2. And then you listed the 3rd one. And I couldn't remember if there was 4 or 5. And Katrina, thanks for jumping in there and clarifying the 4th one. We were just talking about One Health, but Katrina, are you able to expand on that and talk about the mobile outreach programs that are being developed?
This is really exciting. So I think you're referring to the One Health mobile outreach. We are piloting that in Colorado. So I have to circle back to you going to CSU. That's awesome. That's where I went to grad school. Go Rams. Really, Fort Collins remains the hub for this pilot program. So we're recruiting a lot of vet students from CSU, social work students in the public health school, as well as other medical professionals. So nurses, doctors, social workers, and we are caravanning to rural parts of Colorado. So far, we've been to like Kit Carson, Yuma, Walsenburg. I'm forgetting one right now, but essentially we are bringing a caravan of healthcare providers to rural parts of Colorado where access to healthcare is slim. And we are setting up shop similar to a circus. We roll into town, we pop up our tents, we're there for 2 days, and we basically just give all of this free care to those who come. And this is truly a remarkable model, and it is fueled, like everything else, with volunteers and community partners and having very clear communication with the communities we are going to. So we usually set up a meeting several months out, making sure that this type of an event is welcome and needed. And once that's confirmed, then we start figuring out the logistics. And it's a model that can be replicated anywhere. So we're starting it like so many of our programs in Fort Collins, but we hope that it can be a model that other teams can really pivot with, however the need arises in their communities, because we recognize that low income families, people at risk of homelessness, that exists everywhere. That's not just urban populations. That is rural America. And I think especially in rural parts of America where there might not be veterinary clinics within, 20, 50 miles, it's important for us to take away those barriers. And hopefully our goal is to show up in rural parts of Colorado throughout the year as much as we can, because it is truly volunteer dependent. But that is the One Health mobile outreach model that we are piloting, and we hope to bestow upon our teams across the country. And I think it's unique because we haven't put a ton of funds into like getting a mobile unit, having a van, having a vet clinic on the go, which is something we did in Ukraine, which is very unique. And that's a whole nother topic we can talk about. But we have a mobile veterinary unit on the ground in Ukraine providing care. It's not something we're doing in the States currently, just because of the logistics involved with having that in 60 cities. Insurance, where is it stored? How many times are you taking it out? It may be something we look at down the road, but what's so neat about this One Health mobile outreach model is that we're truly using people's vehicles, reimbursing them for gas, and we have a U-Haul trailer that we hitch to a truck that carries all of our supplies. So it's using what you have, like what you literally have in your driveway, to go out and provide care. You don't need to like funnel money into this big van with our logo on it. No, we can just put our supplies in the back of the truck, hit the road, and set up shop.
So Hilary, then I'm hoping to have you talk about whether it's these mobile outreach programs or just the clinics that are put on by the organization. What does that look like on the day of those events? And then what are some of the common types of medical care that are being provided to the companion animals?
I love that question. As I mentioned earlier, I'm fortunate enough to, in addition to my role now as medical director, I'm still a volunteer veterinary team lead in the Bay Area and Northern California, where there's a huge population of people that are unhoused or in precarious, uncertain housing situations. And most of them have pets and are in need of the services we offer. One thing I love is it changes. Every clinic we do is a little bit different. And when Katrina was referencing packing up the trucks, all of that, I actually bought a used pickup truck for Street Dog Coalition. I am not a truck person, but I was so passionate about doing these clinics. And I was like, I need to buy that truck and load it up and get on the road and go. So for us, depending on where we're going to be, a lot of times it just is a dirt lot. And I started volunteering in June of 2020, and we had a really tough time finding other organizations willing to work with us and allow us to come. Everyone was scared of crowds coming in, and the pandemic obviously layered into all of that. So we were fortunate enough that we found actually a parking lot where we did exactly that, where we just loaded up our cars and I grabbed some volunteers. Street Dog Coalition provides medical supplies for these teams. And so we bring those supplies with us. We bring some tables, some pop-up tents for shade shelter. And it's really important to me that we not just provide those for our medical team, we provide those for the people who are bringing their pets to us. We want this to be a comfortable situation for them as well. We bring seating. I found all sorts of great things on the internet, like benches that were collapsible and all the things that you realize when you go out there, next time we need this. And it's inexpensive. It's not a lot of bells and whistles. We'll throw up a banner so people know who we are. And then we usually will try to get the word out in advance by collaborating with some of those community partners. So in my case, we worked with a group that provides meals to people that are unhoused. And again, that's all part of that One Health. Even with the mobile health outreach, I think what they're doing too is making sure they're providing those services too. So we were able to time our clinics on a day when they were already going to be providing meals, and they were able to let people know that we're already coming to them for certain services, that we were going to be there. The advertising is also very organic. We usually just rely on other groups that are doing similar work. We're really the only ones providing veterinary care that I'm aware of in our area, and probably in most areas. And then people show up, and you never know how many might come. Our motto with Street Dog Coalition is we are all about quality over quantity. So if you help 3 people, then you helped 3 people and 3 dogs or cats to be that much healthier and in that much better of a place going forward. And what I did not expect, and really probably what kept me coming back, was not just the amazing feeling of being able to help animals that otherwise would not have access, but the relationships I started forming with the people that were bringing their pets to me, and seeing them come back each time. And then realizing that we were actually providing more than just veterinary care. We were providing a space where they felt seen, and they felt humanized, and they felt that trust and unconditional love. What's interesting is we have photos looking back on those early clinics where everyone's distancing and wearing masks. And even then, that love was so palpable, just knowing that someone was looking out for you on the end of the people that were coming to the clinics. I think that really helped. A lot of them told me that's what got them through those years. And we actually, at one point, we were able to collaborate with some groups once vaccines came around to get a mobile vaccine clinic that showed up at one of our veterinary clinics, and they were there. We never push anything, but if someone wanted to get vaccinated, they had access to it. And so it's just thinking outside the box, being creative, and really opening your heart and your mind to talking to others and seeing what else we can do to work together. I think Katrina referenced even having people come and cut hair. It feels great to have someone wash your hair, cut your hair, provide those things. It's an act of love in many ways. And so anytime from a One Health perspective, we can get those groups involved. And for me, I'm actually working now on networking with some other groups that are doing more of the outreach in some of the rural areas right outside the Bay Area that don't have access to care. We're talking about planning a bigger mobile health clinic that we can do something similar to what they're doing in the Colorado area. So we encourage our teams to find those resources, and we're hoping as we build our staff that we can make that easier for them, and we can start making contacts and giving them that user manual that here are your contacts in your area. We can facilitate those resources and conversations and make it so that they can, again, remove those barriers and provide access to care.
Can you just expand a little bit on the medical care that is offered? Like, what are common things that you're seeing, or if there's trends, what are you noticing there?
Most of our focus is wellness and preventative care. So we have vaccinations. We focus on core vaccinations. Rabies vaccination is a big one. That one's required in, I think, all states. And a lot of people can't bring their animals places with them unless they are up to date on the rabies vaccine. So that becomes important from a public health perspective, but also just, again, keeping people united with their animals. And then other diseases that we know are common in different areas. We provide those core vaccinations for cats and dogs. We provide microchips for pets so that we can register them. And that way, if that person loses or becomes separated from their animal, we have a way of helping them become reunited. Everything, again, we don't force anything. We just offer these services and we educate, and then people can make their own decisions. Even though our focus is on wellness, we do also dewormings. What's really important is flea, tick, and heartworm prevention. Heartworm disease is a deadly disease that affects dogs and can affect cats as well. And it is something that's endemic in most areas. And because we ask our teams to do a minimum of 4 clinics a year, we are able to provide them with enough to give each person at least a few months of heartworm prevention for their pet so they can come back and get refills when the next clinic is hosted. We do see some sick animals, and we see some animals with ear infections, skin infections, matting hair, which can cause pain and discomfort for the animal, nails that are overgrown in some cases. So we do a lot of that sort of mat clipping, nail trimming, cleaning their ears. We have medications that we provide to our teams that they can treat superficial infections. It's not all that common that we see really critically ill animals, but sometimes we do. And so we also try to introduce ourselves to area veterinary clinics that potentially can provide follow-up care for those animals when faced with a medical emergency. But we actually do supply our teams with some basic emergency drugs and with oxygen kits so that if something were to happen, we can stabilize that animal and then hopefully with volunteer support, get them transported to a place where they can receive ongoing care. And part of our fundraising is to help provide the funds to cover the cost of that care. And we do ask that other groups in the community provide a discount for those services just to make it a little more accessible for us as well to be able to cover that cost. But yeah, it's all about looking at the big picture of what will this animal need for them to be able to safely stay with their person and also be at minimal risk of some of these really preventable diseases. We're very dynamic. So sometimes we encounter things that we weren't prepared for. And then Katrina and I get together and I come in from the medical side and say, okay, we're going to need this medication and we're going to have to create a protocol for this disease. And then we add that to the list of resources for our teams.
You're not only looking at what's bringing them to the coalition that day, but you're also then looking into the future a little bit. And I think it's also good to break down some misconceptions. Katrina, are there any misconceptions in the world of either like homelessness or just that you've experienced with working with Street Dog Coalition that you want to break down?
Yes, I would love to. In fact, the quote you pulled from our website is pretty perfect, right? Just because home is where the heart is something that we go by. Just because somebody doesn't have a roof over their heads doesn't mean they don't have a home. Wherever their heart is home. So one of the misconceptions is that if somebody is unhoused, that they are not fit to have a pet. Such a misconception, right? Honestly, a lot of the pets that we see at our street clinics are so loved and so well cared for and so well socialized because they are living their life. They are out in the world. They're meeting other dogs, meeting other people, traversing the world on four legs and not spending 8 hours maybe on the couch while their person is away at work. I'm guilty of working 8 hours a day and looking at my laptop and my dog coming over and pawing at me because I really should be paying attention to him and playing with him. It's not enough to just give him an hour at night or an hour in the morning. He wants love all day. And I wish I could give it to him all day. But that is a lot of times what these pets coming to us are getting. They're getting love all day, exercise all day, and rest when they need it. And as Hilary mentioned earlier, oftentimes the first thing we hear is, my dog eats first. They're giving up shelter. They're giving up food to make sure that their dog or their cat has the resources they need to live a full, healthy life. What they don't have is the money, the funds to sometimes pay for this very basic preventative care that can really improve the wellness and the livelihood of the animal. So that's what we come in and do. We educate, but we don't need to teach them how to love their dog. They are doing that on their own. There is no need to say anything more about that. So I think the misconception is just that if they're unhoused, then it means they can't take care of themselves and they can't take care of their pet. And that's just so far from the truth. And I give these people we meet so much credit. They're doing what they can. The fact that they can get up every day and come to us for care, first of all, that's a hard thing to do, to ask for help. So I give them credit for that. And that they keep going day in and day out. We do not know their story and we don't ask for it. If they want to share it, we will listen. That is where we operate out of unconditional love, no judgment. We don't pry. And we also trust that if they're coming to us, that they truly need the help. So we don't really have any formal requirements or proof of homelessness. We really do operate out of this place of trust and unconditional love and no judgment. I just encourage anyone who maybe has that knee-jerk reaction about people experiencing homelessness with pets, that they're not fit to have them, to maybe just check themselves a little bit, put themselves in the shoes of somebody who's down on their luck or maybe struggling with mental health and might not have the resources to medicate themselves. And one thing leads to another. and they can't hold a job or can't pay their rent and they're on the streets. I just think a lot of people have safety nets that others don't. And the pet becomes the safety net, right? The pet becomes the lifeline, the one that they can talk to, depend on, trust. Dogs are great listeners. And I think we need to listen to them a little bit more and listen to the other end of the leash. So that's what I would say about that. And we do hear a lot of people ask that question. And I think it's changing, honestly. I think slowly but surely we're destigmatizing it. And we're not the only group out there doing this work, which is also really wonderful. I love that there are more groups doing this because I think it does raise awareness. And with each person we're helping, I think we're also reaching somebody else on the other side who might have that judgment.
Absolutely. And so that you can support people to the best of your abilities, for our listeners, what's the best way that they can support Street Dog Coalition and the work that you do?
Threefold. There's so many ways to help. One, of course, is if they want to make a donation. We certainly love that. We have a monthly giving club. So if they want to join the club, it's a really cool club. Only cool people are in it. We really love monthly donors because it does help us grow sustainably when we can count on that gift every month. Any little bit counts. We appreciate making a donation on our website. Volunteering, as we've mentioned, we could not do this work without the volunteers. And you really do get such a high from volunteering. So I would encourage people to see where our teams are located. And if there's not a team near them, maybe if they're a DVM, they might want to start a team. We'd be happy to talk to them about that. We just chatted with somebody from Boise, Idaho, right before getting on this podcast. So we'll have a team in Boise, hopefully. And then honestly, what I was just saying, having those conversations with people about destigmatizing this and advocating for folks that are experiencing homelessness with or without pets. I think the more advocates out there, the better. The more people having these conversations, the better. And I think one often leads to another. So if you volunteer with us, you might join our monthly donation club. If you donate, you might want to volunteer. I think there is a lot of overlap. And that's what's really unique about Street Dog Coalition as well. It's not one or the other. Oftentimes it's both. So I think Hilary and I are both sporting our Street Dog Coalition apparel. We really love our logo. This was designed by a team lead's husband, who is a graphic designer in Ithaca. So shout out to Mac. What's another way? Wear your heart on your sleeve. Make a donation, get a shirt, wear it out in the world. If people ask you about it, send them to our website, and hopefully we'll recruit more people to join the coalition.
I love it. Katrina, Hilary, thank you so much for taking the time and talking today about Street Dog Coalition and the important work that you do. I know that I loved that. I think that's something that it does get stigmatized a lot. And so it is nice to realize there's people out here providing really good work and trying to break down that stigma as well in a world that, some of those people don't often get second glances. There's people out there with golden hearts. So thank you so much for taking the time and sharing about the work that you do today.
Thanks for having us, Matthew. This was really fun.
Thank you so much.
If you enjoyed this conversation, subscribe. And to find out more about the work we do to support animals, visit our website at theechofilm.com. Follow us on Instagram at theechoanimals and follow our TikTok at creature.feature. On behalf of all creatures, big and small, thank you for listening.